Hello, and thank you for joining me today. I'm Julie Lafford, Executive Director of Alumni Engagement at York University. I want to extend a warm welcome to all of you out there in the audience, whether this is your first Scholars Hub at home with us or you've been joining us from week to week. Thank you and welcome to this week's event. This webinar is part of our Scholars Hub speaker series, which features educational lectures by academics and researchers from York. We're very pleased to be able to bring this series online to allow even more alumni to hear from some of the university's leading scholars. Before we begin, I do want to provide a short update on some of the ways York is responding to COVID-19 and supporting our students. Recently, President Rhonda Linton announced that after consulting with the government and public health authorities, as well as Senate Executive, our fall 2020 term will be delivered for the most part online and remotely. Because we're committed to ensuring our students have access to the courses they need to progress in their programs, we're pleased to share that York will be offering our full selection of academic programming this fall. With our country, province, and city beginning to open up, we at York are actively developing a comprehensive academic and operational plan that will support an orderly and phased return to more normal operations on our campuses. The university re-entry plan will be guided by all the necessary health and safety precautions provided by public health and activated when it's clear it is safe to do so. Although we aren't all in the same location right now, I would still like to acknowledge that many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located, and they precede the establishment of the university. York acknowledges its presence on the traditional territory of many Indigenous nations. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably care and share for the Great Lakes region. Before we begin the lecture, I'd like to take a quick poll asking, have you ever attended a York event before this one today? It should pop up on your screen, and I'll give you a moment to respond. And thank you for responding to that. I do appreciate your participation in the poll. It's always great to see so many participants with us today. I know we have nearly 100 already, and I'm sure we'll have more in a few minutes. And when I have the results of that poll, I'd be happy to share them with you. Here they are. 45 of you, 70% have say yes, that you have attended a York event before, so welcome back. And to those of you who are new, thank you so much for taking the time to join us today for this important lecture. If some of you are new to online events, our team is here to help. If you have any questions for the speaker or any questions about this experience, go ahead and click on that Q&A button at the bottom of your screen and enter your question, and our team is happy to help you. Today's talk is titled Canada's Response to COVID-19, featuring Dr. Stephen J. Hoffman, Director of the Global Strategy Lab and Professor of Global Health, Law, and Political Science at York University. Dr. Hoffman is the Dahdaleh Distinguished Chair in Global Governance and Legal Epidemiology and a Professor of Global Health, Law, and Political Science. He's also the director of the World Health Organization's Collaborating Center on Global Governance of Antimicrobial Resistance and the scientific director of the Canadian Institutes for Health Research's Institute of Population and Public Health. His research leverages various approaches to craft global strategies that better address transnational health threats and social inequalities. His past studies have focused on access to medicines, health misinformation, pandemics, and tobacco control. Welcome, Dr. Hoffman. It's a pleasure to have you to join us today.
Great. Thanks so much for this opportunity and for that introduction. And thanks everyone for joining. I think at this time of physical distancing, it's more important now than ever that we find ways like this to be staying connected. So really happy to be part of it, and really pleased that all of you are able to be here. So what I'm going to do today is I'm going to attempt to do four things. First is I'm going to do a brief overview around how this response to COVID-19 has unfolded in Canada. I won't go into too much depth because I think for most people attending this webinar, most of you are, I'm sure, in Canada. And as a result, we probably don't need to remind you and for you to relive your experience, because it's probably quite vivid in everyone's mind. I don't want to give anyone PTSD, but I do want to sort of provide us with a bit of a reminder of how this unfolded. And that will then lead me to a second thing that I'm going to do, which is try to compare how has Canada's response been as compared to many other countries around the world. And I'm going to actually focus in on a few other countries, so 5 others, that give a bit of a representative look at the way many countries have responded. From there, what I'm going to do is then do a deeper dive into Canada's response, looking a bit more thematically about how we overall have addressed this unprecedented pandemic. And then from there, I'm going to end with some concluding thoughts about how does all of this end? What's the end game? How do we get there as fast as possible? And then, of course, there'll be time for questions and answers at the end. So I think that when you think of all of that together, the thing, and I'll give you a sneak peek of my conclusion right at the beginning, which is that I think overall the Canadian response has been very good for this outbreak. I think that, of course, any government's response and every government's response to a pandemic like this could be better. And so there is no such thing as a perfect response to a pandemic. But if I had a choice as to where I would want to live during this pandemic, I would choose Canada. And during this presentation, I'm going to walk through and make that argument as to why I think that's the case. So by way of background, let's first look at some of the initial background things that I think will be helpful for this presentation. And the first is, okay, Canada, we have a population of 37.6 million people. And in Canada, our first case was detected January 25th, 2020. So that was within a couple of weeks of when maybe you first heard of this virus that was circulating in a particular city in China, and that maybe started to spread elsewhere. We were one of the early countries that had a case. But one of the interesting things about that is that we didn't have sustained transmission, though, of this virus for at least a few weeks later, which is going to be actually one of the themes that I convey during this talk, which is that we in Canada were successful in identifying some of those earliest cases that did come to Canada, such that we were able to identify them, contain them, and essentially buying ourselves 2 to 3 weeks in order to figure out what's happening around the world, watch the way other countries are responding to this outbreak, learn from them, and adjust our response accordingly. And those are 2 to 3 weeks we in Canada have been continuously using all the time to see what countries are doing, how do those actions work out for them, and how should we create a uniquely Canadian response in the process. When you look at today's data, as of today, there's 86,647 cases in Canada that have been confirmed through laboratory testing. And unfortunately, we've seen deaths over 6,000, so 6,639 deaths. When you look at the spread, though, across Canada, it is more or less distributed by province according to population, with a couple of outliers. The important outliers, as you'll see on this map, are the first, for the not so good news, is Quebec. So as of today, there's over 48,000 cases in Quebec, which is a disproportionately heavy burden that Quebecers have faced in this outbreak. And then the other outlier is British Columbia. British Columbia having only 2,500 cases that are confirmed, which is disproportionately low compared to their population. Otherwise, though, we are seeing relatively even spread by population across our country. So now moving forward from our background and to walk you through the way this outbreak unfolded, I do want to take your minds to the beginning of this outbreak. And this, for many folks, might only have been at the end of January when the World Health Organization declared a public health emergency of international concern. But many of you might also remember reading in the newspapers or seeing on TV that there was this virus that that had popped up in Wuhan in China, which is in the Hubei province. And there was talk as early as the first week of January that we didn't know if this was, what this exactly was. We knew it was a novel virus. Before then, as of December 31st, we knew that there was a case of viral pneumonias that we didn't know what caused it. So there was a lot of uncertainty, and indeed there remains a lot of uncertainty as to how this pandemic has evolved and will evolve. And we'll get to that throughout this webinar. But there was something that happened that first week of January. We didn't know how big it was, but right away, a week later, the Public Health Agency of Canada activated its Emergency Operations Centre. And right away, a week after that, Canada started implemented screening at its borders. And that was screening where it was about asking people, where did they travel from, and do they have symptoms that would resemble what COVID-19 presents with. We then, a few days later, on January 25th, had our first case in Canada. And it was only a few days later that the World Health Organization declared this to be a public health emergency of international concern. Moving to February, this was a month where there was some more further discussion in the media. So there was one of the things I'm quite proud of, which you'll hear about later, is that at the beginning of February, the Canadian Institutes of Health Research, of which I am part-time involved, that organization right away announced pre-announced for a rapid response funding opportunity to activate researchers, whether they're at York University or universities around the country, in order to do that research that's needed to mount as informed of a response as possible. And what you'll see on this timeline on this slide is you'll see the chronological dates at the top, but at the bottom you'll see the number of cases that had been confirmed in Canada. So essentially, the Canadian government mounted a research response when there were less than 7 cases in our country. So it's quite a robust response. And indeed, when there were 7 cases, there was already $26 million mobilized for that rapid research response, which is great. Now, it was February 20th before Canada had its first case that was unrelated to travel from China. And at that point is when things started to quicken, and definitely, I think, really took on a life of its own, and we'll all very much remember the month of March. This is a busy slide because this was a time when it seemed like every day there was a new announcement. At the beginning of the month, there was the first death from COVID-19, unfortunately. Shortly thereafter, WHO declaring this formally as a pandemic, which means that there was sustained spread of this virus in multiple international settings. And then you might remember that week, it was the week of March 16th, when we started the week when in many jurisdictions in Canada calling for a limit on gatherings. And I remember on the Monday, there was a limit of gatherings of about 200 people. So we were asked, okay, those events, let's say big weddings or big lectures, more than 200 people, those shouldn't go ahead. And then slowly over each day, it seemed like the restrictions on the number of people that should be at a single gathering lessened and lessened. It went from 200 to 100, then down to 50, down to 20. And by Friday, we were asked in some jurisdictions in Canada, such as Ontario, that there should not be gatherings of more than 5 people. So that was quite an extraordinary week. That was also when many of the physical distancing measures came into place. Schools started to be closed. And Canada started to ask people, initially voluntarily and then mandatorily, for travelers coming into our country to enter a 14-day quarantine period, meaning that people had to isolate for that period. And at the end of that week, that was when Canada actually banned entry into our country for foreign nationals. First, it was everyone but Americans, and then shortly thereafter, it included the United States, and that's where we still are. But of course, the story continued. There's still a second half of March. I won't go through this in detail, but just to flag, you may remember that layering of additional protections. Every day a new announcement, whether it was essential businesses being the only businesses allowed to remain open, whether it was new border measures, as well as whether it was new supports for businesses, for employees, for citizens, in order to make sure we can get through this outbreak, and ideally to deal with many of the downstream consequences of the public health measures that have been put into place. The key, though, is that this was a layered approach. So every day a new layer being added, such that we get to a place today where we have quite a lot of layers, and indeed a lot of the conversation now is about which layers are we going to gradually, very slowly lift in a strategic way as we look towards that time when hopefully this pandemic is no longer, and hopefully that's quite soon. that all continued in April. And I would say April was the month when we saw really robust economic and social measures. So huge mobilization of resources, billions of dollars, whether it's a wage subsidy, whether it's the emergency response benefit, whether it's funding for community organizations, Indigenous peoples, as well as additional funding for research, mounting actually in Canada one of the most robust research responses in the world. And then more recently, there's been a real focus on filling in any gaps that had been left through all the April announcements, whether that's extending the wage subsidy program, whether that's contributing to the global fight against COVID-19, as well as ensuring these efforts apply to those groups who were at earlier stages might not have been included. That was the Canadian response in a nutshell. I hope it jogs, hopefully it doesn't jog bad memories. Hopefully, though, it jogs maybe some silver lining memories. I mean, one thing that's clear is how Canadians have really come together during this period, this very difficult period. So I think that's maybe something that is maybe a silver lining. But of course, this was and has been and continues to be a very tough period for many Canadians. So many Canadians, unfortunately, have lost their jobs. Too many Canadians have been affected or who have died from this outbreak. But what we have seen is quite a few months that we had behind us, which then gives us, I think, an opportunity to think about how did our experience in Canada compare with other experiences if we were in different countries. And for that, what I'm going to do is I'm going to really look to just a few ways of comparing. And the first is I'm going to look at school closures. And so what you see on this slide is a comparison of the dates at which different countries started to implement mandatory school closures. And so what you'll see is there's 6 countries here. So I'm comparing Canada to 5 other countries. And so what you'll see is that the very first country on March 2nd to implement mandatory school closures was South Korea. And that was followed by Italy 2 days later. And then 9 days later, Canada and Israel started to implement school closures. A couple days after that, the United States. And then 5 days later, the United Kingdom. And so these are the countries I'm going to consistently compare Canada to. Why these countries? They present an interesting point of comparison. And these countries are also the ones that I find are very much in the news and that might be of interest to this audience. But so this was a chronological comparison. And so what you'll see is, okay, Canada was sort of in the middle of the pack in terms of how fast we implemented mandatory school closures. But what I'm going to do next is I'm going to compare these countries not in terms of the chronological sequence, but in terms of when did they enact mandatory school closures according to how many people were infected with COVID-19 in their country on a per capita basis. And there you see actually Canada was actually the earliest country of these in order to mount mandatory school closures. And we did it when there were only 3.6 cases per million in our country, which is quite significant. Whereas other countries like South Korea, which chronologically was the first country to implement mandatory school closures, instead this country actually implemented it when they hit 86 cases of COVID-19 per capita in their country, per million people in their country. So actually 20 times as many cases as what we had in Canada. Now, looking at a map, what you'll see is that school closures chronologically came in at different times across different populations. So you'll see this is a map from March 1st, which was really when only a few countries, so China, Mongolia, Iraq, had implemented mandatory school closures, as well as Germany and Italy. Followed by some other countries. This is on March 16th. This is when Canada implemented its mandatory school closures, or some jurisdictions in Canada did. Layering it on further, April 6th. This is when really most of the world had mandatory school closures. And then today, this is this data would be as of yesterday. This data reflects that actually we're starting in some countries to see the lifting of those mandatory school closures. Some of them they're required school closures, but in a different ways. For example, maybe only certain grades, or a limitation that only, let's say, a quarter of students can be in a building at the same time. That type of thing is starting to be lifted whether it's in France, Germany, Denmark, or Finland. Moving away from school closures, let's look at the border. And so this is really about when did countries close their borders to foreign nationals. And so you'll see again, the first I'm going to present chronologically. In this figure, you'll see that Italy was the first country in this basket of countries to do so. That happened on March 10th. And then it was a few days later that Canada closed its border, followed by efforts, not a full border closure, but border restrictions starting to take place in the United Kingdom, the US, and Israel. But again, we'll see that while Canada was not the earliest country to do so chronologically, it was the earliest country to do so on a per capita basis when we consider what number of cases we had in our country. And indeed, Canada closed its border when it had only 8 cases per million in our country. The United States doing it later, and then Italy actually much later in terms of the trajectory of its outbreak. 152 cases per million in Italy before it took border measures. Now I put in the top right-hand corner, you'll see I put the South Korean flag. You'll notice they're not on either timeline. And that's because South Korea actually up until today has not imposed border restrictions. So actually you and I, if we wanted, we could fly today to South Korea and go there. That is if a company did fly there. I know Air Canada is not. I don't know about other companies, but that's their border remains open. So now looking at again the map and how this came in, this is January 17th. So this is only 10 days after we first heard about that virus, that new virus coming out of Wuhan, China. 10 days later, Nigeria was the first country in the world to impose a total border closure. They're an early mover. Now that was at a time, I remember when that happened, thinking that was quite the overreaction. I mean, indeed, border measures overall, there's really limited science as to whether they'll work, and a lot of doubts among scientists about whether border measures actually do anything. And we can talk more about that in the Q&A if that's helpful. But when Nigeria did, I remember everyone was thinking like, whoa, that's very early. And if we closed our borders every time a novel virus emerged, we wouldn't have very much travel happening in our world. Because of course, novel viruses, it happens all the time, except that this one, unfortunately, is one that has had some severe consequences and spreads quite quickly. But then after January 17th, we'll see 10 days later, we start to see screening in place. So the yellow is when the screening. Canada was one of the first countries in the world to ask those questions to incoming travelers about where they had traveled to and whether they have symptoms. And indeed, I know that there was a lot of questions in the media at the time as to whether those voluntary questions actually do anything. They did actually catch our first initial cases of COVID-19. And that is why we were able to buy those critical 2 to 3 weeks, such that we in Canada have always, fortunately, been behind other countries in the trajectory of this outbreak. And we've been able to always learn from other countries and watch and see which approaches work best. So that's this yellow screening, super important, even though I remember at the time there was a lot of doubt as to whether questions at the border actually do anything. Moving from there, we started to see some more bans on travel, particularly from high-risk regions. Now, this is important. So this is the sort of the deeper orange color, like the color that you see in Russia and Australia. And the reason I highlight that color is because while I mentioned earlier that there isn't very much science about the effectiveness of total border closures, like what we've done in Canada, we do have a lot of science about targeted border closures. So basically that's like border closures saying anyone from that country, a particular country, in this case it was mostly China, people targeted China and didn't allow people to travel from there. We do know from lots of studies that actually doesn't work because people either go first to a third country and then proceed to where they want to go to, or they find means of traveling through unofficial channels, which actually undermines the public health response. So what you'll see here is the deeper orange color, really not helpful that those countries did that. And they also violated international law in the process, but we won't go there during this webinar, although happy to do so during the question and answer period. From there, we see March 13, more measures being put into place about banning travel from high-risk regions like China. And then March 17th, even more. March 18th was when, or at least when this data, when Canada implemented its full border closure, including the United States at that point. And then so you'll see there's many countries that lock down travel. And by the point we get to April 22nd, this would be the height of those border measures, where actually most countries in the world, but not all countries, had closed its borders during this outbreak. Moving to today's date, what you'll see is there's a start to a reopening of borders, which is something that I'm sure we're going to see more of going forward. Certainly, I hope so. Moving on away from border measures, let's talk about the rapid research response. I mentioned, I gave a sneak peek as to this is something I'm quite proud of and something that I think all of us can be proud of in Canada, is that the Canadian research response was both fast and disproportionately large as compared to other countries. So for example, the European Commission was actually first. They announced 50 million euros through the European Commission mechanisms as early as January 30th. That was followed by the United States on February 3rd. And when it comes to research, there's just no comparing to the United States. They invest more than 10 times per capita that we do in Canada. They are extremely impressive when it comes to the investments they make in science. And it was great to see the United States mobilize for COVID-19. That being said, most of that 1.78 billion that I mentioned there, most of it was not new research funding. It was actually taking it from other important areas, whether that was HIV or tuberculosis. It was a redirection of existing resources, although since then they have announced new resources. Canada came next on February 10th. And as you might remember, we actually pre-announced on January 27th that something would be coming. The formal launch coming on February 10th, and that was $54.2 million, quite a lot compared to the size of our population. And that has enabled quite a robust Canadian research response in the process. The UK came after that, 10 million pounds. And then on March 17th, Israel announced 50 million shekels as part of its effort. Now moving away from research, let's just look at the facts. So this is how many total cases there have been of COVID-19 confirmed in each of these 6 countries. And of course, what you'll see in this figure that's totally dominating everything is the United States. The United States, while not the source or not the place of origin of this virus, I would call it now ground zero for this outbreak. It is where there have been the most cases. It is where the biggest sort of threat of further spread to the rest of the world is coming from. Now, usually in Canada, we're so lucky in that we're bordered on 3 sides by oceans, which actually does provide some nice protection for our country. We do, though, as a major vulnerability, have, of course, the world's longest undefended border in the world, which is with the United States. And so this is why the United States and what's happening there is so important to the Canadian context and top of mind for many policymakers and public health officials. You'll see, though, the other trajectories are lower. But the thing I'm going to flag is how they are all really flattening, which is what we want to see. In an infectious disease outbreak, because each case you get then gives more opportunity for every new case to be, for it to be spread to, we often see an exponential spread in infectious diseases. So indeed, if you look earlier on in the outbreak, you'll see it has a bit of an exponential curve upward before it starts to go to a straight line. And essentially what we want, at the very least, is just a straight line. Now, of course, we want it to be a flat line. We want to end this outbreak and fully contain it. But the key is, as long as it's not a curve upwards, it means we don't have exponential spread. And that's the most important thing. But of course, ideally, we want to curve downward towards a horizontal line, because that means that this outbreak is no longer spreading. Moving that away from cases, let's move to then testing. And I think this is where a really interesting part of this outbreak is to be found. And so this is data now on a per capita basis. So basically, how many COVID-19 tests are being performed each day in each of these countries on a per capita basis. And so what you'll see is that all countries have ramped up their testing over the course of this outbreak. And this data is showing from February 20th all the way until yesterday. And what you'll see here is that as of today, the two countries performing the highest number of tests are Israel and Italy, which is impressive. So it's almost 60 tests per 1,000 people in their countries. Canada is actually lower, so we're under 40 tests per 1,000 people we have in our country. But actually, what matters isn't the number of tests per people generically. What matters, what's even more important, is how many tests per cases of COVID-19 in a country. And that's where the most interesting part of the testing story comes, which is that South Korea, which is so low right now in their per capita testing, is yet one of the countries that has really excelled in its response. And the reason is not because of where they are now, because actually they have so many fewer cases, they don't need to worry about as many tests right now. What the impressive thing with South Korea is, if you look earlier in the slide, how fast they were able to scale up tests for their population when they really needed it. And it's that earlier phase, it's that fast scale up that allowed South Korea to get their outbreak under control so quickly. Whereas at this point, for example, in the United States, you'll see that they were quite delayed in ramping up their testing, quite a bit delayed beyond Canada, for example. And so yes, even though the United States today is performing more cases, more tests per person in their country, actually they need to perform exponentially more cases because their outbreak is so much worse south of our border than it is in our country. And so actually, I would say Canada is in a better place, is in a much better place when it comes to testing than the United States, because we were able to scale up earlier, although not as quickly as South Korea, which really is the standout here. I'm going to now move away from the country comparisons, which I hope was helpful, towards, now that we've seen how Canada has responded as compared to those countries, to take a closer look at the response in a more thematic way. So one of the key themes I want to emphasize is that this response from Canada was what I'd call a total government response. Every part of the Canadian government, and working with provinces, municipalities, other stakeholders, has been mobilized to mount a response to this outbreak. We're talking hundreds of billions of dollars, the unprecedented $72 billion wage subsidy program, for example. We've seen a $1.1 billion rapid research response to this outbreak. Never seen anything like that before in the Canadian context, as well as many other measures that have been taken. In terms of that research response, this is now sort of all of the key steps in sequence. And I think the key here is, yes, it's about how much has been going. Yes, it's about the layering of it. But I'm going to point you actually to the left side of the slide. January 20th is when the internal workings of Government of Canada started this effort. And indeed, I remember on January 20th, that was the day in the morning, Xi Jinping, who's the president of China, made an extraordinary statement asking for provinces in China to make sure they were reporting all data and to work closely with international authorities. And I remember that day very clearly because I remember seeing that on Twitter as I was boarding a flight in Europe, returning to Toronto. And I remember saying, like, that's a very weird statement for the president of China to make, right? Asking for the cooperation of provinces in China and to release data and work with international authorities. I remember the time thinking, oh, is this going to be that pandemic that people like me who study pandemics and research it sort of every day, is this going to be that pandemic that we need to get activated for? And anyways, I boarded my flights, and by the time I landed in Toronto, however many hours later that was, I remember seeing that the cases that were reported out of China had doubled in that day. Essentially, there was this call upon authorities to make sure they were releasing full data. And hopefully that happened on that day, but enough of it happened on that day that at the Canadian Institutes of Health Research, which is the government agency responsible for funding health research in the country, they were able to activate that response. And I have a half-time role with the Canadian Institutes of Health Research. And so it was that day that we started calls and activated an emerging health threats process, of which I'm quite proud. Everything then proceeded from there. And indeed, that response is an ongoing response. And so as recently as last week, there was further funding announcements in order to ensure that the researchers in Canada are able to mount an effective response, because we know in this outbreak that there's still so much we don't know. And we know that the best response to a public health emergency like this one is one that's informed by the best available research evidence. So there's no way out of this pandemic that doesn't include science. Moving away from science though, which is of course, as a researcher, one of my favorite topics, is then looking at policy action. And I won't emphasize this because I've talked about this at length already, but I did just want to emphasize that this has been a layered approach. So for example, at the border, which is controlled by the federal government, we've seen a layering, first of screenings, then of border closures, and then additionally of mandatory quarantine that's been put in place for those Canadians who are exempt from the border closures, of course, because they're citizens and have the right under the Canadian Charter of Rights and Freedoms to enter our country. But then within Canada, most of the measures have actually been at the provincial or municipal level. And I know that's caused a lot of confusion, because what it means is that we have measures in place in Ontario, for example, that might not be in place in Quebec, or it could be different than what we're seeing in Saskatchewan. And announcements about these measures, of course, are not all timed at the same time. But in each province, we did typically see, again, a layering approach. Schools, then a request for people to work from home if possible, then mandating working or closing of businesses that couldn't work from home, and then even closure of parks and recreational centers. Huge financial measures. I won't go through it, but it's been almost $300 billion that has been spent to mobilize this response to the outbreak and to address the downstream consequences of it. And then finally, we've seen just different kinds of public communication tools being used. I think one thing that's really interesting is we've been seeing daily press briefings from the Prime Minister, as well as the country's chief public health officer. We've also seen frequent press briefings from provincial authorities and municipal. There's a one-stop shop website on the Canadian government's website in order to facilitate information sharing. And then the messaging, while of course it's different across provinces because this outbreak is different in each province, and indeed each province is going to take different approaches in light of that, I would say there's been a surprising consistency in the messaging across provinces, and there's been a very positive adjustment of that messaging in light of new evidence that emerges. And I think maybe wearing of masks is a good example, where initially the evidence did not support their use. And now, and frankly, actually, it's only really recently, like in the last week, when there was a new study that came out that highlighted that, okay, maybe in those places where we can't maintain 2 meters distance, maybe then it does make sense, like in a grocery store, maybe it makes sense for everyone to be wearing masks, non-medical cloth masks. But that the key though is to maintain the 2 meters physical distance as much as possible, because that's actually our greatest protection. But anyways, there's been some very consistent messaging, and it has evolved in light of new evidence. The thing that I'll conclude with in terms of the response is this a slight adjustment to this famous quote. So if there's any Spiderman fans among us, there's the quote that, well, that's been at least ascribed to Spiderman. Probably someone said it before him, that with great power comes great responsibility. But in this case, I flipped it. So with great responsibility comes great power. And I think the reason I frame it like that is because I think governments around the world feel a great sense of responsibility to do something and protect their citizens. And with that great responsibility has come the great use of powers, whether it's emergency powers, fiscal powers, social powers, communication powers. We have been seeing sort of an unprecedented role for government in our society. And so then the last thing I'm going to do in the next few minutes is just talk about okay, we've seen a huge government mobilization in Canada and around the world. How do we go back to normal? And I think the short answer is that we're not going to see normal for quite a few months. And the reason for that is we still have the same level of risk as we did back in March when this thing was spreading exponentially, because most of our population does not have immunity to it. And so even though our numbers right now are looking good, that's great news, but it just takes sort of one case and one super spreading event for this to go back to a place where there's exponential spread, and where even if we've started to peel back some of those layers of protection, that we'll actually have to potentially reinstate them if we do get to a point of exponential spread. So, but how do we ultimately get to the end? And I will flag there's only 4 real scenarios, and all of them depend on science. So the first scenario is that we could artificially boost our immunity. So that would be through a vaccine. And this is where my hope lies. I mean, this is the best scenario. Everyone hopes we get a vaccine soon. The challenge is that it takes a long time to develop vaccines. So it's unlikely that we're going to see a vaccine ready for use in this calendar year. And even if we get one at the beginning of the next calendar year, it takes a very long time for it to be manufactured for the number of people that are going to want to get it. So that's one option. Let's hope we get there and get there as fast as possible. The second is that if we find a treatment that effectively makes this no longer as deadly or as severe as what it is right now, that would effectively end the pandemic. I mean, it wouldn't actually end the spread of the transmission, but if we could make this as not severe as like the seasonal flu, then we could start treating it like the seasonal flu. And one way to do that is if we developed a treatment that was very easily manufactured, and that basically, if you got it, you take a pill or something, another way of taking the medicine, and then all is good. At least for those who are able to access it, and that's the key there. The third is we could actually scale containment by somehow figuring out how to do rapid diagnostic testing. For example, if we had a way that everyone could wake up and the first thing they do is test whether they have COVID-19, we'd be able to contain this really fast, because, okay, once we have a case of COVID-19, we just would stay at home for 14 days and it wouldn't go anywhere. It wouldn't transmit. We're not there with our testing. We don't have the technology that would enable that, but we are starting to see rapid diagnostic testing, which might soon become available to high-risk communities or to remote communities where laboratory testing is not possible or not as easily possible. And so as a result, if that technology could somehow be invented to enable mass testing every day, that could be a way out. I don't expect that's going to happen. The fourth way out would be if we were able to figure out who was immune to this virus or who was more susceptible or less susceptible to it, we could actually start to implement more targeted, more precise public health measures. Whether, for example, that's more precise about who needs to physically remain distant, or whether it's some other measures, like which areas of the country need these measures and which don't. My bet, though, is or my hope, at least, is on the vaccine, so the first one. And of course, there is a fifth scenario, which is that basically almost everybody gets this virus and we achieve herd immunity that way. That's not a good way out of this, but frankly, that is the way we've always addressed every pandemic up until now. We are, and I think this is really important note to end on, which is that we are attempting something that has never been achieved in human civilization, which is we are trying to stop a pandemic in its tracks and actually change the trajectory of the pandemic. Now, the first time that we really, I would say, modified the trajectory of a pandemic was H1N1. We had the science and technology at that point, not to stop it. I mean, it went everywhere and then petered out naturally, but we were able to modify it so that we didn't have the worst of the circumstances that it could have caused. With this, we're literally trying to stop a pandemic in its tracks. We've never succeeded in doing this. But myself and many others in this space think that the science probably is there, that this time, well, at least I think this time, will be able to do it. And certainly the World Health Organization thinks that. Our own public health authorities in Canada think it. And that's why we are trying efforts that we've never tried before, like these physical distancing measures, because we are actually trying to achieve something that no country, no world has ever achieved before, at least on the planet Earth. So the last thing is, so emergencies, I think, are really important moments for all of us, because they're the times when we have the opportunity to reflect on and act on our core values. And I think that's important because when we think of this public health response, we need to make sure that we recognize ourselves at the end of it and don't look back on this outbreak and think, but like, who were we when we responded to this? I think that applies to governments. So for example, we need to make sure all of our government responses are informed by human rights considerations, by our concern for multiculturalism and diversity. But we also, as individuals, need to think about this as well. Like, what do we value? And what does that mean? And how does that translate into the way that we act in our society at this critical time? And the very last thing I will mention as my final slide is that we also, in acting in this outbreak, need to remember that this isn't even the worst case scenario. I know that this has been extraordinarily difficult for all of us, and particularly those who've been directly affected by it, whether it's for people who have who are in long-term care facilities or have family members there, or people who have lost their jobs, or people who have gotten COVID-19, or who are constrained in the ability to live their lives in the way they want to live. But we have to remember this actually isn't the worst case scenario. First, it could be more severe. So it could actually, for example, kill more people who get it. And second is it could spread a lot faster than it does. And so in that respect, we need to make sure that during this outbreak, we learn as much as possible in order to inform our response to the inevitable next pandemic that comes our way. Because otherwise, we would have squandered this opportunity in order to prepare for that next one and to mount as best of a response as possible. So with that, I will conclude, and thank you in advance for the conversation that I'm sure we're about to have, and really appreciate you being here and having this opportunity to spend this time with you.
Dr. Hoffman, thank you so much. That was really, really fascinating. And I wanted to mention in particular, the timeline was such a great tool for helping understand and reflect on, what we've been through. There were points in the timeline I had completely forgotten about. I made some notes. So thank you personally for that. I know we're just over time, and I do want to commit to the audience that we're going to wrap up really shortly. I'm going to take 2 questions from the audience, and then we'll close for the day. But I do want to thank you again for that fantastic lecture. I have a question from Michael, who asks, how can Canada prevent a second wave, or at least mitigate it?
Yeah, so in terms of a second wave, we actually don't know if there's going to be a second wave, in the sense that there's nothing inevitable about a second wave. What a second wave really means is that it's recognition that we remain at risk for getting this virus, and that if you remain at risk to spark an outbreak, then chances are over a long enough period, it's likely that a second wave will come. And indeed, third wave, fourth wave type thing. Now, the reason why people keep on talking about the fall is because there's a couple of things that happen in the fall. The first is that people typically start to recongregate in larger crowds, such as schools and universities. That's a key thing. And the weather starts to get colder. And we do know from science that we don't fully know how much the cold or warmth affects the virus, but we do know that that is an important factor. So this virus does not spread as easily in the warm weather as it would in cold weather. How do we prepare? We need to use this time to ramp up testing. That's probably the #1 thing in the Canadian context. We also need to use this time to figure out how can we change our normal way of doing things. So for example, universities, including York University, are engaged in a process of thinking about, okay, how do we deliver these services, and how do we reopen businesses and parks and things in ways that reduces the risk as compared to if they were operating as they normally would. So for example, maybe that means moving online as possible. Or maybe that means only having half the number of students in a classroom as would normally be there. These are things that what they do is we use the time to figure it out. It's not obvious how to do these things. And so as a result, we need that time and we need the science to develop in order to inform how we do it. That's key. And ultimately, if in 3 months from now, let's say we get a second wave there and we're just as ready as we are now, that would have been a waste of the next 3 months. But also, that being said, I would say that the response thus far in Canada has been pretty good, so that as compared to other countries, I do think we are much better prepared to deal with this outbreak over its full trajectory as compared to other countries.
Thank you for that. I have another question from Tim, and this is an interesting one because you mentioned our border with the US as being a liability. And Tim asks, how long should we keep the border closed with the USA and what would drive the reopening?
Yeah, so I'm actually not convinced we have to keep the border closed at all. And in fact, I think that what we know in terms of targeted border restrictions from previous outbreaks and the science around them, that they don't typically work because people can travel to other countries and then come to Canada. For example, let's say we opened our border to the rest of the world but kept it closed with the United States. You could imagine if people want to get to Canada from the United States, they could go first to Europe and then travel to Canada. So it doesn't actually make so much sense. But I think the good news is, I would say, at least according to the science, there's many factors that inform this decision, but we could probably already open our borders. And I know that's counterintuitive, but the main reason is because in Canada, we've actually applied 2 levels of protection. The first is the border closure, right? That doesn't allow non-Canadians to come in. But the second one is that mandatory quarantine period for 14 days, such that anyone who enters our country has to isolate for 14 days, which is the period during which the virus might spread to other people. And it's not a voluntary measure, it's a mandatory measure. And the fines for breaking it are quite significant. We're talking about up to $1 million for a financial fine, as well as quite a bit of time in jail. This is a serious mandatory order, which achieves near universal, close to 100% compliance because of the consequences and because people recognize why it's important. As a result, if that is fully implemented as it now is, and if the government deems that it's an effective protective barrier, then in some respects, you could already open the borders even right away, because it would just mean that people who want to come would have to be open to spending 14 days in quarantine. And so we're not talking about tourists. No one would want to come and see the beautiful Canadian Rocky Mountains or the amazing city of Toronto if they have to go through a 14-day quarantine period. But you could imagine lots of people, like those who are maybe moving here for important work, or for families being reunited, or people, all sorts of reasons, who might need to be in Canada, whether it's funerals or to be part of the birth of their child, right? There's lots of reasons why people would be willing to spend 14 days in quarantine and happy to do so. So I hope that was maybe not the answer that was expected, but I think an important one that really emphasizes why we need to think of the various measures that have been that have been implemented and have been proposed as being about layers of protection. Because even if people, and most Canadians, would not point to the border as the first measure to lift, it could actually still be one of the first measures that gets lifted, because we have an almost duplicative layer of protection already in place that enables almost 100% of the same protection without many of the downstream consequences.
Super interesting. Thank you for that. I'm getting several questions that are, can I have the slides? Where do I get the notes? And I just want to quickly answer that. This lecture is going to be available on both our Facebook page and our YouTube page. So audience members, you can access these slides at any time. Please feel free to share those with friends and family as well. I know I'm going to be. This has been super fascinating. Thank you so much. And particularly taking the time to be with us when you must be under a lot of professional, strain and stress, and you must be just extraordinarily busy right now. And I really do appreciate the hour you've given to us.
No, thanks for the opportunity. It has indeed been a busy time, but I think we need to find opportunities to make sure that information gets shared and have an opportunity to, as I said at the beginning, remain as socially connected as we can at this time of physical distancing. So thank you very much for the opportunity.
Thank you so much. Before I say goodbye to the audience, I just want to thank you as well for being here with us for the last hour. Greatly appreciated. I have one last poll for you. It will take you 10 seconds to answer, and that's, would you recommend this event to a friend? It's popping up on your screen right now, and that really helps us determine whether the content we're delivering to you is valuable. As I mentioned before, feel free to share this talk with your friends. You can find us on Facebook and on YouTube, as well as Twitter and Instagram. If you have any feedback for us, please email us alumni@yorku.ca. And be sure to join our next Scholars Hub lecture. It's taking place live next Wednesday, June 3rd. It's featuring Professor Fuminori Tokihashi. He's speaking about countermeasures to the supply chain disruptions associated with COVID-19 over the longer term, and it will be a fascinating lecture, I'm sure. So thank you all once again for taking the time. And as always, on behalf of York University, I wish you continued health and well-being. Be well.